The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, welcome to tonight's webinar on the importance of male hormones, testosterone, and the impact of hormone deficiency. My name is Adrian Chen and I am the CEO of HealthTree, the host for tonight's webinar. Our speaker for this evening is Dr. Siew. Dr. Ho will speak for 10 minutes on the importance of male hormones, and then we will open the floor to 20 minutes of question time. At any stage, you can submit a question to our moderator by entering a message in the chat box. Now for a quick word about HealthTree. HealthTree is about three things. Number one, educating the public on important health issues through free webinars, videos, and blog articles. Number two, making healthcare more affordable through discount medical packages. Number three, our online store where you can buy pharmacy items and supplements at hard-to-beat prices. We recently launched our website, www.healthtree.com.sg, so come visit us for better health and affordable healthcare. And now I would like to introduce you to our speaker, Dr. Siew. Dr. Ho is a Singapore Specialist Accreditation Board certified urologist practicing at Gleneagles Hospital, Singapore. He has a Bachelor of Medicine and a Bachelor of Surgery from the National University of Singapore, and he holds fellowships at the Royal College of Surgeons in Edinburgh, the Royal College of Surgeons in Glasgow, and the International College of Surgeons. He is also a Fellow of the Academy of Medicine in Singapore. Dr. Ho is active in research and teaching. He has given numerous presentations and published many papers in regional and international peer-reviewed journals. He is a clinical teacher and an examiner for the National University of Singapore, Nanyang Polytechnic, and the Edith Cowath University of Western Australia. He has lectured and performed live surgical workshops in many countries in Asia, and he has trained many urologists from Indonesia, Myanmar, Philippines, and India. And now, without much further ado, I'll hand you over to Dr. Siew.
A very good evening. Today I'll be talking about the importance of male hormone, testosterone, and its impact of hormone deficiency. Testosterone is the sexual hormone in men. It is present in large quantity in men, but it is also found in very small amount in women. Testosterone is a chemical that is produced mainly by the testicles and it circulates in our bloodstream. In addition to the expected sexual effects, it has various other effects on different organs in our body. It is the main sexual hormone and is responsible for normal sperm production in the testicles. It is also responsible for normal erectile function of the penis. Testosterone has a strong mental effect in increasing sex drive, mood, confidence, and memory. It also stimulates muscle and bone growth, increasing physical strength and endurance. Testosterone increases red blood cell production in our body, improving the oxygen carrying capacity of the blood. A male child is born with very small amount of testosterone. Testosterone hormone then rises during puberty, and a normal amount of hormone is essential for a boy to develop into a man. Testosterone hormone reaches a peak during our 20s and undergoes a slow decline in levels as a man ages. Hence, the normal testosterone level in a young man may be twice as high as in the older man. As testosterone declines, the protective effect of testosterone is gradually lost. Signs of low testosterone include change in mental status, resulting in depression, loss of short-term memory and concentration, and sleep disturbances. Sexually, there is a decline in sex drive, erection, and the volume of ejaculation. Physically, there may be a sense of lack of energy and strength. Bone and muscle mass will decline. In addition, there is a significant accumulation of abdominal fat resulting in a bulging waistline. Skin dryness and loss of body hair is another sign of low testosterone. Many international studies have suggested that low testosterone is fairly common and may affect up to a quarter of all males as they age. In a Singapore study done in 2008, we found that low testosterone is present in 1 in 5 men at the age of 50. The incidence rises further to 45% in men at 70 years old. Hence, low testosterone is a common problem that many men may have taught themselves to accept as part and parcel of aging, instead of acknowledging it as a problem and learning to seek treatment. Testosterone therapy is not for every aging man. Low blood level of testosterone, detected by a simple blood test, along with one or more of the earlier mentioned signs of low testosterone, is necessary before a diagnosis of medically significant low hormone can be made. The simple blood test to detect the level of testosterone hormone is usually done in the morning, and it can be conducted in most medical or specialist clinics. Hence, there is no special preparations required for this test. What are the benefits of testosterone therapy? The benefits of a carefully planned testosterone therapy is the actual reversal of the many signs and symptoms of aging. Firstly, sexual function improves with improvement in erection and libido. Osteoporosis, or a medical condition of soft bones, are prevented and can be reversed when testosterone is used in conjunction with calcium and vitamin D supplements. Its effects on muscle mass is that it increases muscle mass, and abdominal fat is then reduced when testosterone is used in a combination with good and regular exercise. In patients with diabetes or hypertension, testosterone therapy promotes better control of sugar and blood pressure. There are many ways of administering testosterone to the male, and testosterone therapy, it is not new. Implantable pellets have been in existence as early as in the 1940s, but it has fallen out of favor now. Progress has been made in safety of testosterone preparations with minimal side effects to the liver. Currently, in Singapore, the most commonly used method of testosterone administration is by daily application of a testosterone gel or a 3-monthly injection of a testosterone reservoir. Oral testosterone pills that can be consumed daily are also fairly popular. All these methods of delivery of testosterone are equally effective. Individualized therapy can be prepared for each patient based on his needs and preference. Generally, testosterone therapy is safe and effective. However, it must be administered by a doctor trained in this area. Regular blood tests to monitor the level of testosterone are necessary so that adjustments can be made to the doses. Testosterone therapy may increase the risk of prostate cancer and blood clot formation only in individuals who are recklessly receiving therapy, without proper monitoring and supervision. Testosterone is certainly not recommended in men with normal blood testosterone levels who desire to have a higher performance status.
Wow, thank you, Dr. Ho. That was very informative. I didn't realize that more than 25% of men can actually have low testosterone issues. So just a reminder to the audience that you can enter your questions through the chat box, and I'd like to open up the floor to questions. Okay, here's a question. Are there foods and supplements which can increase or decrease the testosterone levels?
It may surprise us, but many people may not know that testosterone is actually made from a cholesterol compound in our food. Hence, a moderate or a well-balanced diet consisting of protein, carbohydrate, and a small amount of fatty acids and cholesterol is actually essential for normal testosterone production in our body. So my main emphasis is that in order to have a good level of testosterone, we will need a balanced diet.
And another question we've got here is, does exercise influence these levels positively or negatively?
Exercise in general is good for health. Exercise has a positive effect on testosterone. During exercise, there's a release on natural hormones and chemicals in our body that will stimulate the testicles to increase testosterone production. We have done studies and we have medical studies proving that exercise alone can cause up to a 20% increase in blood testosterone level.
Okay, now for another question. What are the risks of testosterone replacement therapy?
I would like to emphasize the keyword is replacement. Replacement means we are bringing blood testosterone level in an abnormally low testosterone level man to a normal level. In this situation, the risk is very minimal. However, in situations where testosterone replacement therapy has been overdone or unmonitored, then exceptionally high and unmonitored level of testosterone can lead to increased risk of prostate cancer as well as formation of blood clots in our circulation system.
Okay, another question. Are there any side effects that come along with testosterone replacement therapy?
Yes, there are a couple of side effects with testosterone replacement therapy, particularly if it is unmonitored and testosterone level is allowed to go beyond a normal healthy level. It will increase a person's risk to prostate cancer as well as blood clot formation. In a younger person with exceptionally high level of replaced testosterone, it will affect the sperm production within the testicle. So it is unexpected or unexpected result which many patients do not understand. Many people believe that if testosterone is high, there's a higher chance of better sperm production. But on the contrary, exceptionally high level of replaced testosterone may suppress sperm production in a young man.
And actually, I was also wondering with the testosterone therapy, is it a series of injections that are administered to the patient, and or is it pills? If it's injections, is it administered to a particular part of the body?
The most common form of injection testosterone therapy in Singapore is a 3-monthly or 12 weeks depot injection. It is an injection given over the buttock every 3 months, as the medication has a slow release technology that allows the drug to be released and absorbed very slowly and evenly over a period of 3 months.
And so does testosterone, will it not create sexual benefits for all who seek it?
In a man with low testosterone level and has, as a result, lower sex drive as well as poorer erection, replacement of testosterone alone will most likely improve his erection function to near normal, as well as will significantly improve his libido. Now, in men who not only have testosterone deficiency but has also pre-existing erectile dysfunction due to blood vessel problems or any other causes such as diabetes or high blood pressure, correction of testosterone alone may not solve the problem of erectile dysfunction. Testosterone replacement in this situation may have to be used concurrently with other erectile dysfunction oral medications.
And how much does testosterone therapy cost in Singapore?
Comparing the 3 methods that is commonly used in Singapore, namely the 3-monthly injections, the daily application of gel, as well as daily consumption of pills, the average cost is about $400 every 3 monthly.
And another question similar to one that was asked before was how to increase male testosterone levels naturally?
Male testosterone can be improved naturally in a significant manner, and studies have shown that it can be increased naturally by up to 20-30%. Number one, by having a regular and well-monitored exercise program. We talk about regular and monitored as in the exercise program should be individualized to a particular person based on his fitness. Secondly, consumption of a balanced diet is essential for normal testosterone production.
And what are the dangers of low testosterone?
As testosterone has multiple protective functions in the male body, an exceptionally low testosterone level will then take away this protective effect, as what we have discussed earlier. The main danger is that it will predispose a man to softer bones, namely osteoporosis, whereby with minor injury, the bones may fracture. It will also decrease the muscle mass in a person, resulting in then accumulation of abdominal fat.
And here's an interesting question. What are the benefits of pellet therapy?
I'm not too sure about this question on pellet therapy, but I presume the audience may be asking for or asking about the implantable pellet testosterone. Now, the implantable pellet testosterone can be used, but it is less commonly used as to implant a pellet, it involves a minor surgical procedure done under local anesthesia, whereby a pellet of concentrated testosterone is implanted underneath the skin around the arm region, and each testosterone implant or pellet can last between 6 to 12 months.
Okay, and what may be causing my hormone imbalance?
Hormone imbalance can be due to many factors. It can be due to a medical condition whereby the testicles are not functioning or not producing the amount of testosterone expected of that particular age. Secondly, medical conditions such as uncontrolled diabetes, hypertension, or even mental conditions such as depression can suppress testosterone levels. Largely, external factors such as excessive stress, inadequate rest, or consumption of excessive alcohol can also lead to testosterone reduction in our body.
So if I'm wondering, let's say that I'm a corporate executive, I'm working very, very long hours, I'm overweight, I'm not eating a proper diet, am I a good candidate for low testosterone levels?
Yes, I think you have actually described spot on the profile of a candidate with low testosterone, particularly if this candidate is above 45 years of age. Most men below the age of 45 would seldom have symptoms of low testosterone, but they may begin to have some of these symptoms from the age of 45 onwards. Unfortunately, many of them may not recognize these symptoms and may just attribute these symptoms to prolonged tiredness or fatigue and missing the diagnosis of low testosterone.
Now, I've got a question here which came to mind as I was looking at one of your slides. So in one of your slides, you've got a graph which shows from one age group to the next age group the level of hypogonadism, which I presume is low testosterone levels. And it was interesting that 15% below the age of 45 could have this low level, and then it seems to drop between 45 to 49, and then it starts to increase again. But why is there a drop between 45 to 49?
Well, this is just an observational study. We do not really expect a drop, but we think that it is just an observation in the population group that we have chosen. Yeah. What we believe, and most international studies shows that between the age of 45 to 65, there is a general incidence of low testosterone in the region of between 20 to 30%. But what we found, and it is also consistent with international studies, is that the incidence or prevalence of low testosterone jumps significantly from the age of 70 and above, where it hits maybe even up to half of all male population.
So that's an interesting point, that if it suddenly skyrockets above the age of 70, if let's say the elderly gentleman isn't treating it, is he setting himself up for some problems?
Well, it really depends on what is the expectation of the elderly gentleman. We emphasize that yes, testosterone replacement is important if testosterone levels are low in our bloodstream, but it must also be coupled with the mentioned signs and symptoms. If an elderly man with low blood levels of testosterone but is totally unaffected by any of the signs and symptoms, then I think there is no need for replacement. How can that happen? Well, in an elderly man who eats well, who exercises regularly, who maintains a healthy lifestyle, will most likely be able to avert common medical conditions such as diabetes or hypertension. He may not be overweight, and he may have a good bone density, as well as a muscle mass. So in the absence of all these problems, he will probably not require any form of testosterone replacement therapy.
Okay, and let's say that I'm a man in my mid-30s and I've got a wife and we want to have a child. Does having a low testosterone influence my fertility?
Yes, that is a very, very weighted question. We then have to go back to the fundamental. Why is this couple not able to conceive a child in a normal expected period? Is there a problem with the sperm count? And we know that sperm is manufactured in the testicles, and we also know that testosterone is produced in the testicle. Hence, having low sperm count may be a sign that the testicles are not functioning well, and therefore testosterone may be low as well. In this situation, a short period of testosterone replacement for about a month or two may help the improvement in the sperm count. Otherwise, further investigations will have to be done to determine the exact reason behind the poorer sperm count as well as low testosterone.
Okay, so we've got time probably just for another couple of questions. And so we're wondering whether does pollution or environment play a role in testosterone levels? I heard an interesting case of or speculation that in Australia that the level of estrogen in recycled water could actually influence male fertility. Are there things that we could be drinking in our water or breathing in the air which could actually affect, say, the testosterone levels?
Well, it's interesting that you brought up estrogen and the environment. We have no clear evidence at the moment that there are strong environmental factors that may affect testosterone production directly. Now, estrogen is a female hormone, and contrary to what most people believe, estrogen is also present in a man in small quantity, which means both male hormones and female hormones are present in men and women, but in different ratio. Testosterone is high in men, whereas estrogen is low in women. There will be some men who have an exceptionally higher than expected level of estrogen, and that can then result in a diminished effect of testosterone, resulting then in lower libido, poorer erection, and many other sexual dysfunctions.
Great. Well, I think time has got the better of us. That was a very interesting, informative session, Dr. Ho. Is there anything else that you'd like to add?
Not at the moment, and thank you for your time and attention.
Okay, so now to the audience, if you'd like to book an appointment with Dr. Ho, please email us on info@healthtree.com.sg and provide your name and mobile number so that we can contact you. And thank you everyone for joining in tonight, and please watch out for future webinar sessions on HealthTree. We will actually post a recording of this webinar in case you came to the webinar late. Just go to www.healthtree.com.sg and look for video interviews. Thank you very much. Bye.